Welcome back. This lecture will cover the diagnosis of health sector related problems and how we can go to the policy formulation from these diagnoses. Once you have decided which performance problems to focus on, you have to determine causes of the poor performance. This process is called diagnosis. Identifying potentially effective changes in one or more control knobs is the end of the diagnostic task and the beginning of the policy development stage. Analysts first work backward to causes, next they have to look to policies to change those causes, and then work forward from causes to forecasts of improved performance. A few assumptions have to be made when developing a health system diagnostic tree. So there can be several stages or series of causes involved in a particular problem, or each effect may well be produced from more than one cause. Each cause is likely to have multiple effects, and causes and effects may interact and reinforce each other in various ways. So there may be multiple ways the causes and effects interact with each other and can cause more problems, and the effect can be stemmed from many other causes. The idea of health system diagnostic tree has come from decision tree, which is used for analyzing decision under uncertain circumstances. But there are some differences between these two. While each branching point in decision tree corresponds to a mutually exclusive events, here in the health system diagnostic tree, this branching point refers to a cause, and these causes are not mutually exclusive. So this is the example that's given in the book. Suppose we have a government that decides that it has a higher rate of maternal mortality compared to other countries, especially among its rural poor. Also suppose that the government decides to make improving this rate a priority. The first step is to consider the broad categories of causes. Three possible causes that often contribute to high maternal mortality are high-risk behavior, inadequate healthcare, and poor socio-economic conditions. The next question is, what aspects of nation's health services are inadequate? This stage shows how a causal analysis reaches back through successive causes of poor performance. The health system diagnosis tree is just a way to keep track of the causal chains involved. So, here we need to sort out the relative contribution of each of the two causes. How much of this is due to insufficient quantity of care versus insufficient clinical quality? Keep in mind that the options are not mutually exclusive. This is more likely than not a problem of both quantity and quality. Going back even further, we'll start to show additional factors. Why do we have poor clinical quality? Is it because there are no incentives for the organization to produce quality? Or are there no incentives for managers to do better? Or is it that managers lack the skills and the authority to do better? Obviously, behind each one of these endpoints, there could be further causes that require more analysis. Alternatively, if the main issue is with the quantity of services, then we can ask, why is the quantity of care insufficient? Is the answer on the demand side or supply side? On the supply side, it could be as simple as the lack of physical availability of these services, meaning clinics, hospital staff, supplies and such may not be available. However, if services are physically available but they are not being used, then the problem is on the demand side. It could be a lack of perceived need, or it could be that the low quality of service may make it unattractive. It could be the presence of user fees or the requirement that patients have to pay for certain drugs or supplies. So this example shows that it is not always easy to separate supply from demand in the real world. Sometimes low demand may be due to the nature of supply. To see this, we'll do one more graph. Suppose that the system is technically inefficient due to high cost. What could be causing the technical inefficiency? Is it because of poor management, lack of effort from the workers, or is it due to failures in the system of production? So as you work backwards along the causal chain, you start to identify more and more specific causes that allow us to identify specific solutions. This eventually leads us back to the health system control knobs. So the control knobs provide a framework to consider possible interventions to improve health sector performance. Basically, they provide a list of options. Here are some comments about the actual process of policy development, and here participation of stakeholders has been stressed on for a better policy development process. So participation helps the policymakers to grasp the idea of the interest groups, their own acceptance, and they can be educated through the process also. So process itself can be just as important as the content. With this, we have come to the end of the first part of health reform book that covers the health system analysis, and in the second part we'll cover the control knobs, the important concept about financing, payment, organization, regulation, and behavior. So see you then.